ordering inpatient and outpatient medications. So to look at this is just an example of an order screen that's you'll see in the Omaha pharmacy or through the Omaha master menu, I should say. Notice the headings. This is just when you click on pharmacy, you have inpatient medications, outpatient medications, and then also there's a heading called the clinic medication orders, which we'll talk about in a few slides here. So when you order medications, probably the most important thing, one of the most important things is just to make sure that you're ordering the medications under the correct encounter or visit for where the medications are going to be given. This is particularly the case when you're doing clinic medications and inpatient orders. For example, like a patient that is going to be admitted but has not been admitted yet in the system, make sure that you're ordering those under the correct encounter. What you want to do is you want to find the correct menu. Again, that's the inpatient, outpatient, or clinic meds like that was in the previous slide. Make sure that you're using the quick orders when possible, especially for IV fluids or IV piggybacks. A lot of the rates and doses are pre-built in those quick orders, and then there's also some special instructions too that will want to be copied over when the pharmacist verifies those. So try to use quick orders when possible. When you're using the drug library, you'll want to pick the correct, medication, of course, the correct route, and then the correct scheduled frequency. Another thing is for, in particular, inpatient medications, make sure that you click the now when doses are appropriate. So if you have an admission coming in around 10 or 11 o'clock in the morning and they maybe haven't gotten their morning medications, you'll want to make sure that you're clicking now so then the patient does get that first dose when it's appropriate. There's a new piece of this as well. You have to select an indication. There's a drop-down box that shows some of the new most common indications, but you can also free text. It's not quite as intuitive that you can free text in that box, but you are able to. And then make sure that you're utilizing the comments box for any sort of specific instructions that you want when you want the patient to take this medication. So for example, if you only want the patient to take Tylenol for mild pain or for a pain scale of 1 to 3, you can type that into the special instructions. So what I'll do is I'll pull up my CPRS here so I can kind of show you what this looks like. And so again, we do have a test patient here, and this is under the Omaha master menu is where I'll pull this up. This is the screen that you'll get next. You'll want to click on pharmacy for pharmacy medications. And then notice we have these headings again, the inpatient, outpatient, and then the clinic medication orders. So what I'll do is I'll just pretend I'm ordering some medications on this test patient on the inpatient med quick orders. It kind of breaks it down into what type of medication it is. So I'll click under endocrine meds, and I'm going to order metformin for this patient. So I'll click on this metformin 500 milligrams. And I just got a dialogue because this patient isn't technically admitted, but that's okay. We're going to continue on. The next pop-up that pops up is the actual medication order. So you can see there's a dosage medication of here's 500 milligrams oral twice a day. So everything is filled out. I do have to fill out this indication field now. That is a requirement. So there's only one in the drop-down box, and I can say for diabetes. You can also free text in this box as well if there was a different indication. Here is where that now dose is. So since this patient is being admitted later in the afternoon, if I wanted him still to get his morning dose and then also again his evening dose, I would check this give now, give additional doses. And so this is just okay. And then we can go ahead and then we can accept that order. And I'll do that. Okay, moving back to the PowerPoint. So that's just an example of how to order a medication through the orders tab there. And then getting back into this PowerPoint, which I will go to the next slide. So this is kind of the medication flow for outpatient prescriptions, is that you have the provider orders the medication in CPRS. The pharmacist reviews every pending order and will verify the prescription. Now, in outpatient, you have the option to select either window or a mail order for where the patient's going to pick it up. Either the patient can be sent the prescription in the mail, or they can go to the window and pick it up. Now, just note that if you do select window, meds are not filled automatically. The patient has to check into the pharmacy kiosk. Then they will be called up to the window, and then the pharmacist will counsel the patient at that time and fill their prescriptions. So if you do select window, there is a little bit of a wait time. That it's not immediately filled automatically. They do have to wait in our lobby until the medications are filled. Also, be aware that the VA does not provide outpatient medications prescribed by non-VA providers unless the patient has been given a prior authorization to get medical care outside of the VA, which is also known as care in the community. So, looking at how the workflow is a little bit different in the inpatient or the clinic setting. Again, the provider orders medications in CPRS through the meds tab or the orders tab. The pharmacist reviews every pending order and verifies the medication. So the medication, if the patient is admitted in the hospital, it's filled through inpatient, and it'll either come up to the nurse in a unit dose packaging, or the IV room will prepare it, or there'll be some medications in the med cabinet, like the Pyxis machine. So with the clinic medications, the patient no longer picks up their clinic medications from the window. The medication will be available in the clinic for the nurse or the provider to administer. So that is a little bit of a change that we've made this past year. The patient will no longer go to the window to pick up their clinic medications. They will be available in the clinic for the patient. And it's the same thing where it'll be through unit dose packaging, IV room preparation, or medication cabinet through the Pyxis. Another part of the order menus is the antimicrobial CDSS. So there is a section of antibiotics and various diseases that the provider can work through. So we would prefer if the providers use the antimicrobial CDSS menu when ordering any antibiotics, whether it be inpatient or outpatient. And there's two different options there. This is a screenshot of after you click into the CDSS menu, what it looks like. And what again, it's kind of set up like Sanford Guide. You can either pick by an organ system, or you can pick a specific organism, and then you can work through that tree to find the exact organism or disease state that you're covering. So this is just kind of reiterating that. Basically, you click on the main menu of the antimicrobial CDSS menu. It takes you through this various tree, and you click through which antibiotic. Then it gives you, of course, recommendations. There are quick orders in there, and then there's also various resources if you want more information. For the CDSS, this contains recommendations for most infections, but not every infection out there. So if you're unable to find the infectious disease, you can, of course, call pharmacy, or you can reach out to put a consult in for the infectious disease teams. There's also quick orders that are pre-programmed with recommended dose, frequency, and duration. So that's a nice reason also to use the CDSS menu. And one thing just to be aware of is when you do order through this CDSS menu, you're going to get some in the special comments. You're going to get this message that'll show up, and it'll say pharmacy confirmation number ... And basically that just that's an identifier for the pharmacist when they verify the order, that they know that this medication was ordered through the CDSS menu. So in inpatient, the pharmacists typically leave that comment in there. And then in the outpatient menu, the pharmacists do not include that because they don't want that to show up on the prescription. It's just more, again, an indicator for the pharmacist. You can still type in the other comments section, and that's where you would type things for, take with food, for pain, et cetera, et cetera. And then the pharmacist will be able to include that pertinent information there. This is another screenshot that just kind of shows more on this menu with the CDSS and what some of these various codes mean. I'm not going to dive into this, but there is a key at the top there if you're interested. So when you order medications, kind of like what I showed previously, was you can order medications either through the orders tab or through the meds tab. So if you're doing it through the orders tab, you can also do complex orders, and then you can also choose specific days of week. So this next slide just kind of shows an example of what the outpatient medication screenshot looks like. What I'm going to do is I'm going to pull up CPRS again, and I'm going to order a medication through the outpatient profile this time. So again, I clicked on pharmacy. I'm going to go over here to outpatient medication quick orders, and we're going to order stomach acid medication. We'll just go ahead and order Milk of Mag. So notice, like what we talked about previously, it has the dose, the route, and the schedule on there. You'll notice this comment up here for PRN. That is checked because I want this to be like that. Or I want it to be a PRN medication and as needed. So I do have to select an indication. I can either pick something from the drop-down box, or if I wanted to free text something, I could say for stomach acid. I can free text something in there like that. Of course, then you would want to delete the provider comments here. So if you want to say take on empty stomach, you can fill that out as well. You want to pick where either it's a mail order or it's a window, and then also make sure that you're filling out the day supply, the quantity, and how many refills they need. Now, something else I wanted to show is if you wanted a complex regimen, or perhaps you wanted this patient to take it twice a day for 1 week and then follow up and just do it as needed after that, then you would click this complex button at the top. And that's where you can put in a various regimen. So we can just say, we can change the schedule here to twice a day. And we'll click off the PRN, and then we can say we want them to do that for 7 days. And then we'll do insert a row, and then we'll do 30 mLs orally Q day PRN. So just remember that complex section at the top. That comes in handy for prednisone or various tapers that you may want to do, either tapers up or tapers down. Okay, and I'll just quit out of this, back out of this order. So that's how you order medications through the order tab. There's another way to order medications also through the medication tab. And what you're going to do here is you're going to highlight the prescription, you're going to right click, and then either you can click the change, discontinue, refill, renew, etc. There's also an easy trick if you want to copy a bunch of orders, like from the inpatient profile. If you have a discharge and you want to copy a few different orders so the patient can go home with those, you can highlight those prescriptions and then say action and transfer them to outpatient or transfer them to inpatient. So I'll show you an example of that. What that looks like over here is, notice at the bottom I'm on my orders tab. I'm going to switch over to the medication tab instead. And what I can do is, if I want to copy these outpatient medications into the inpatient, you can just right click the medication order, and you can say change if you want to change the prescription, or you can highlight the medications that you want copied into inpatient and just say action transfer to inpatient like that. And you can also do the same option up here. You can say action change, action discontinue, action renew. All of those options are there. When you right click, there's just a few of the more common options, but up here under the action icon is where you'll see all of the various actions that you can do with those medications. Okay. Probably the last piece of this section is going to be talking about BCMA. How do you find out if your patient received a medication? And what you'll want to do for this is you'll want to look under the medication tab, double click on the inpatient order, and then you can scroll down to the order details and you can see how often a nurse has given this medication. So for this example, I'm going to select on an actual patient that's been admitted. And what we can do is we can click here on medication, double click on it, and you can see that this medication has been given and the following dates and how many they gave. So in this example, we're recording this in January right now. So we see that this patient received this medication on January 24th at 8:11 a.m. and they gave 1 tablet at that time. So again, to find BCMA information, to make sure you know your patient got warfarin last night or whatever you're looking for, you go under the meds tab, find the medication, double click on it, and then scroll down to the order details here.